And welcome back. It's now 4 minutes away from 7 o'clock, and as promised before the break, we're sitting down to have a conversation about World Cancer Day. Brain in gear. And joining us, we have Laura Longsworth, President of the Belize Cancer Society. We have Dr. Jorge Polanco, NCD Focal Point from PAHO, WHO. Charmaine Garcia, Communications Officer for the Belize Family Life Association. Good morning and welcome to the show.
Thank you. Thank you for having us.
Now, World Cancer Day. Let's talk a little bit about perhaps the origins of it and how it is used as a galvanizing tool for societies across the globe.
Well, the whole issue of World Cancer Day is to, I like the fact that it's slated for February 4th every year, because it's at the beginning of the year and it reminds us to get moving and get rolling in terms of addressing issues related to cancer. So it's a global thing. They have international organizers and it's taken off. What we do at the Belize Cancer Society is we always have to stay in touch with regional and global activities, because it tells us what's happening out there, and it helps us to move our posts, get moving with initiatives that we can do to support our cancer awareness activities in Belize. For us, we have adopted a team. I can understand that early detection saves lives. And we thought that it was fitting that we take back that theme. We've always had that, where whatever we do, that we carry that. But most importantly, it was one of the early themes in the early days of when the society was being formed by Mrs. Soberanis. That was one of her battle cries. And this year is the 28th year. So yes, I can't believe 20 years have gone. It tells you how old I am. And so we have taken that on and we'll be using that theme throughout the year. We're going to be doing a lot of stuff for the Belize Cancer Society. We want to, after 20 years, we want to focus on some of those things that have been lagging behind, and now the world is pressuring us because we attend all these regional and global conferences, and we need to take our place. Yeah. It's simply because Belize has come a long way. Yeah. There are lots of cancer services, but it's not enough.
Now, of course, one of the most important information to get out is to look at what the reality is in the country and what we're facing. Right. And for the past couple of years, and I think for quite a while, we've been talking about preventable cancers and how those tend to be the most prevalent ones in the country. Is that still the case?
I think that it's not only for us, it's globally. And I'm sure Dr. Polanco will speak to that, but prevention, you cannot continue to ignore the fact that investing in preventative measures is absolutely important. However, we need to know that the entire gamut, the continuum of care has to be there. It's prevention, it's primary, secondary, and tertiary. So some of us will have cancer. So what do we do to take care of ourselves? What do we do to detect early? And if we are diagnosed, where do we go? How receptive is the system to our care?
This is a great time to bring in Dr. Polanco to talk about the regional and global perspective when it comes to cancer. When you talk about NCDs, non-communicable diseases, cancer is included in that collective group and a priority for the WHO and PAHO.
Yes, of course. You are correct, and I want to follow up an idea that Mrs. Longsworth just stated, that a lot of cancers are preventable, and it's our duty to really address areas with the objective of prevention. The World Health Organization and the Pan American Health Organization have, over the recent years, well, actually over the last 15 years, have recognized that indeed the urgency to give priority to NCDs in general, to non-communicable diseases in general, cancer being one of them, just for the purpose of defining, when we say NCDs, we refer to cancers, diabetes, hypertension, obesity, for example. Cancer being a chronic disease, now we in Belize, the strategy has been to capitalize on the resources that we have, considering available technology, medical technology, financial resources, human resources. And of course, without a doubt, our priority would be to put emphasis in preventive measures. Many, as Mrs. Langsworth said, cancers are preventable. And of course, let's put the first example, cervical cancer, for example, is very, very preventable. And sorry, the efforts of the Pan American Health Organizations are to support Belize in all possible ways in regards to strengthening capacity for prevention and control. And of course, you will have some cases, and the idea is to provide the best care with the available technology in the region to extend the lives of persons with care. There is something very important that, let me go back to the example of cervical cancer. If it is detected on a very timely manner, it stays there. It doesn't progress to us, to a further stage. And I think that is where Belize has been putting its emphasis in prevention and control.
We still have cervical cancer as one of the top causes of top cancers in the country. Yeah, in women. And it's interesting, and that's how we can move on to BFLA at this point, because when we talk about services, BFLA has been offering screening tests for a very long time all over the country. So let's talk about the efforts being made. And you've also added new services as well that definitely assist in early detection and even treatment.
Right. Well, one of the things BFLA promotes a lot is the pap smear screening. And the new service that we offer now is the VIA. That's the the vinegar treatment. And we partnered with, BFLA partnered with Cancer Society, and we're promoting the Smear for Smear campaign. So with the Smear for Smear, you put on your lipstick, smear it, like, let me smear mine.
We're
So
going to
you
get
put
a
on your lipstick,
demonstration.
and you can just smear it, take a selfie, nominate some friends, and it can be male or female. Like for the male, what we did around the office, we kissed the male on their cheek, and we took the photo. Could nominate whoever you want, and hashtag smear for smear, and tag it to BFLA's page or to Cancer Society. If you are someone who have a story on cancer, you can say, put a little note on why you think the pap smear is important.
And this is, of course, spreading awareness
for
the importance of getting your test done.
Right.
Yeah.
And it's important. It's an important initiative that we like the partnership. I think that in the entire NCD movement, we recognize that partnership is very, very important. And so the Belize Cancer Society has been really playing a pivotal role in the whole issue of advancing the whole issue of the NCD Commission and so on. Why? Because coming together we can share our scarce resources and so on. We have been very active, the Cancer Society. We've recently, last year we attended an NCD conference in Dubai with a lot of regional and European players. And then of course the Cancer Society, the Belize Cancer Society along with partners here created a World Health documentary, a small documentary. And so I went up to Geneva to attend their big conference there to talk about NCDs, and that documentary was aired. So that was really nice. The issue of cervical cancer, we are going to take it and run with it. We are very much involved in sensitizing the community, mainly the faith-based organizations. We're moving to teachers, and will soon be coming to the media and the schools to talk about the HPV vaccine that's going to be introduced later this year.
In the Ministry of Health.
That's right. Where
schedule.
The
That's a
Ministry of
great
Health is
accomplishment.
adding the HPV vaccine to their vaccination schedule.
Wow.
Amazing. So
let's talk about that, though. And I don't want to lose that because it's a big deal.
Yes,
We're
that's
talking
huge.
about preventing the virus that can
Yes.
potentially lead
Yes.
to cervical cancer.
That's right.
Is it only for young girls, or are we giving it to young girls and young boys?
It's Dr. Polanco will tell you it's very expensive. It's a big investment.
Yes.
But we purchase the vaccines through PAHO's vaccine revolving fund and so on. And so the Social Security Board is saying, let's do that if it means that 5 years down the road we'll be able to say Belize was able to reduce the incidence and prevalence of cervical cancer. So that's going to happen this year.
So, Dr. Polanco, in terms of the importance of the vaccine itself?
No, of course. There was a lot of discussion to really justify the introduction. Like every vaccine, you have to do feasibility studies, and PAHO assisted Belize in that feasibility study. Belize Cancer Society was part of that commission. And indeed, and the interesting thing is that Belize has committed, the country of Belize has committed, and as Ms. Laura said, the purchase order is already in for the procurement of these vaccines. So indeed, it's a big stride because over 90% of cervical cancers are associated to HPV. And knowing this and having now the vaccine, a lot of discussion went into deciding what cohort, what age group would be the first one. And I think that's a big plus.
What
So
age
what was
group
decided
will
on?
you target?
Is it 11 or
Probably
12?
10 between, actually, it's going to be standard for children.
Okay.
But
That's
we'll
10.
really create a great sensitization plan to make sure that people get the right information about
Obviously, sorry, we'll be jumping the gun here because I know you're
Yes.
saying this is going to happen later, but we know from experiences in other countries, there have been concerns with the HPV vaccine, just getting parents to buy in, to give approval. Because HPV is a sexually transmitted disease, much like reproductive health information, people get a bit nervous. What are you teaching the children? Is that going to be a part of your education campaign, that parents know you're really saving the life of your daughter rather than telling her to go out and engage in any behavior?
It has to be, and I think that it offers the introduction offers a great opportunity to healthcare providers to partner with schools, faith-based organizations, and families to educate and to exchange ideas about growth and development, because the development of your child it parallels your sexual growth and development. And we need to understand that we need to talk about it a little bit. What we're saying is we want to make our children the best people that they can be. So what can we do to make them better human beings? We give them vaccines earlier. As they grow older, they don't only need a vaccine, but they need education. They need building of their self-esteem. They need education. They need the right information. We need to be comfortable enough, get to that point where we can give them a little bit more, and they do have a right to having the right kind of education, information about taking care of their bodies.
There is something important. What has been said is in regards to cervical cancer, but the issue of education and taking care of their bodies goes even beyond just cervical cancer, because recently you look into the scientific literature and there is abundant evidence whereby obesity has been linked to cancer. It's not even an indirect cause, it's a direct cause. To cancer of the esophagus, of the stomach, the pancreas, the lungs, the kidneys. So now, knowing that it's a risk factor, the question is how can we as a country move in addressing that risk factor of obesity and overweight, which has been a topic in this show multiple times. The important thing is that the health authorities in the region, the ministers of health, have mandated different forums, Washington and sorry, and COMISCA at the level of Central America, the Council of Ministers of Health, to move in the direction of strengthening strategies to address overweight and obesity. And of course, not only for the purposes of preventing cardiovascular diseases, but cancer is there as part of an NCD linked to overweight and obesity. So then the question is what to do in Belize. And I say this because much thought has been given to addressing diet and overweight and physical activity. And I could say activities have gone in that direction, but I believe there is still much more to go. The latest national survey that is an official figure revealed that about 2/3 of the adult population were overweight, sorry, not 2/3, 1/3, and another 1/3 obese. But if you combine the two groups, you're speaking of 2/3 of the adult population at least overweight. So then it's an issue, and at the level of the Directing Council, which is the Ministers of Health for the Americas, they have given specific mandates for plans to be implemented in this direction. So along with the Ministry of Health, we have begun discussion. Mrs. Langsworth made reference to the NCD Commission that recently met with the intention to give priority now to these risk factors. Yeah. One more idea. Speaking of risk factors, it is very interesting that last year a global survey was done. 23 countries participated, and 4 areas were looked into as part of the response capacity of different countries to address NCDs in general. One was governance, second was risk factors, surveillance and research, and finally the response to health systems. And it was very interesting to note that in practically all the countries, with the exception of one that had a score of about 60%, I think, all the other countries got a very low score in addressing risk factors for NCDs. More countries got the highest score in the response to health systems, but when you look at the indicators looked in that area, it was basically the availability of drugs, the capacity to diagnose, et cetera, which is fine. But when it comes to addressing the reasons for getting sick, that's where practically all the countries had very low scores. And by low, I mean scores as much as 15, 20%. So then it is critical for all the countries in the Americas, because you had several countries of the Americas participating and the Caribbean, to really take a pause and say, okay, let's put more efforts in addressing the determinants of health, in addressing the risk factors.
So that's what we're moving into here in Belize, to look at how we can educate people in prevention.
In addressing those risks for cancers.
Those risk factors.
And that's one of the things I wanted to really dwell on, because we keep talking about sexual and reproductive health, the education or lack thereof in terms of access for young people. How does this tie into perhaps efforts from the Ministry of Education to look at the whole HFLE curriculum and how that is handled?
Health rights.
It's interesting because that's the big discussion in wherever you go. It is not only, and the approach is not only multi-sectoral, but it's intersectoral. So, and it requires all of society, all of community, all governments, everybody to get involved. And if you really have, even in Belize, if you look at it, the groundswell, the big government approach does not necessarily work. If you look at health and healthcare requirements, it's a groundswell. The Cancer Society was born out of one person's journey, and so here it was. If you look at Diabetes Association, we remember seeing one person talking about dialysis and care of the diabetic patient, and so on. So it's that you can't ignore that. Those are lessons learned that the world has taken on, and so the entire community is all of government, all of society. So there's no one person that has to lead. And what we need to do a better job of is engaging our community in terms of how can we be healthier. I think, Doc, you didn't mention the whole issue of prostate cancer. Yeah. And I think we really need to start showing, because the prostate cancer numbers are really almost parallel with cervical cancer numbers. And it worries us a lot.
And is it late stage?
Yeah, most of the time. Like cervical cancer.
Yeah. In the Americas, the leading cause of mortality of cancer in men is prostate, followed by lungs. And Belize is no different.
No different here.
Yeah.
But we know
And
there's
that
some
was what-
cultural issues there as well, that men are fearful of the
Accessing
digital rectal exam, which is part of the screening. But there's also a blood test that can be taken.
But it's more than that. It's that remember
Men
we are
accessing-
kind of socialized differently. Women, because of who we are and our physiology, we are always in the doctor's office. Maybe with menstrual cramps when you're young and moving up. Boys don't get menstrual cramps and so on. So it's not, the girls tend to be more into the doctor's office. And so now our men grow up and they don't make health a priority. And going in to do a checkup, remember, because a woman is childbearing, they're in the, and so on. What we need to remind our men that we need to walk together because we need to take care of each other.
Yeah.
And especially, we have to take care of ourselves, our families, and we always have to look at the productivity. When we lose our men and our women, and especially those in their great productive years, what happens to the country?
One of the things I have seen over the past month, being at BFLA, is a lot of men are accessing our services. A lot of them prefer coming in with their partner, and that kind of stood out to me this month, watching the amount of men coming into the center to do their different tests.
And that's interesting because BFLA is very much youth oriented, and also it's not like stepping into a public health clinic. There's a different feel when you move into an institution like BFLA. What from the experiences that has been seen at BFLA, what do you think are some of the barriers that people have when they come in and they finally talk with people? What are they saying are some of the reasons that they hesitated in the past and changed their minds?
I think mainly it was the perception of BFLA being a more youth-friendly organization instead of for the entire family or adults. But we have some packages geared towards the family, and I think overall it's just the perception. You think BFLA, you think teen pregnancy, you think contraceptives, but like I said, a lot of men have been accessing the services, and I think that's a change towards our mentality, and it's just a matter of us pushing it more. And I think we could see
the environment that was created.
Yeah.
Now, we're getting ready to wrap, but we want to know what are some of the things that people can do today as a part of the commemoration of World Cancer Day. Are there activities that people can tap into besides the smear campaign?
Really, we want people to really sit and reflect. Most of us have had a friend or somebody with cancer, and really to consider how we on an individual basis can take responsibility for our health, and to just look at what we're doing with ourselves and our families and our friends, like the smear campaign and so on, is can we motivate each other to take care of our health this year? Can we walk with a friend for a pap smear? Can we do other things? Can you influence a guy to walk in with their friend, whoever that friend is, to have an exam done and so on? And I also want to say to the community, the Belize Cancer Society, we continue to grow. We continue to appreciate the support of the community, and we will be very active this year in terms of fundraising. It's very expensive to do education. We're the only institution that goes all over the country to do sensitization and so on a sustained basis. And so it's all volunteer work except for Heather and Debbie in the office. We're all volunteers. And so we want the community to see the Cancer Society for the work that we do. We provide a safe place. We provide guidance and advocacy through the health system. So we just want them to understand where the resources are.
And you have one center in each district.
And we have a center in each district.
Yeah, it's very important to have in mind that indeed, as part of the prevention and control strategy, screening is fundamental. it's fundamental. But apart from that, that screening at the individual basis, it's necessary for the population to be informed that we have other types of cancers, for example, lung cancer, and a significant proportion is linked to smoking. In Belize, the latest figure, which was the last survey, was that in adults over 15, at least 35% of them had smoked over the last 12 months. In the survey that was done with high school children, the prevalence was still around that compared to other, which means that the impact of education still needs to be a little stronger. Something extremely important is physical activity, as another risk for overweight and obesity. The latest available figure is that 57% of the adult population is physically inactive.
That's believable.
57%. So all the figures match with the 2/3 of overweight. So then, and these are things that need to be done from school age right through into adulthood. I must say that along with the Ministry of Education, the Ministry of Agriculture, Ministry of Health, and our office, we are currently working in promoting and making physical activity as part of a component of health education more visible in all schools. You could remember that nutrition quiz that Belize used to have. Okay, now it will be converted into health and wellness competition quiz, which will go beyond nutrition, will include physical education and information on other chronic diseases that whereby information will be provided to the children at that early age.
And of course, Charmaine, the Smear for Smear campaign is on, so people
Smear for Smear is on. If at the end of the campaign we have a photo with the most likes, we'll have a little package for that person. Again, I want to ask and encourage everybody to take advantage of the screening. We have a center in Dangriga, Belmopan, San Ignacio, Orange Walk, and of course our centers in Belize City.
And you can get both the pap smear and there's also the VIA, which is detection and treatment at the same time.
Yes.
Excellent.
Well, thank you all for joining us this morning.
Well, thank you for having us. Make
right.
sure you join our campaign.
Yes.
Right.
I'll leave the smear on William by the end of the show.
Marlene, so I'm
Oh, well,
waiting
then
for
I'll
that
have to do it. And then I'll leave the smear for William too. Right. Thank you very much. And of course, we hope that people have been able to get some very important information this morning as to what can be done in terms of prevention of cancer. We're going to go ahead and take a break. When we come back, it's for looking at Belize's plan for addressing Zika. So stay tuned.